AI just cut diagnostic errors by 31% across major health systems. Here's what November's breakthroughs mean for your private practice. I'm Dr. TJ An, podiatric surgeon, MIT AI Executive Program grad, and I run multiple healthcare consulting companies, including continuing medical education event company CME Dynamics. Every month, I cut through the AI noise to show you what actually matters for your private practice. For November, I fed the top AI healthcare developments into Notebook LM, Google's research synthesis tool, and had it create this unique video overview. You can augment Notebook LM for many of your medical practice aspects. So leave me a comment below if you want to see some use cases for your practice. I'll make a video or two on how to create your own audio and video without actually being on mic or a camera. Okay, let's see what AI did in healthcare this month.
Welcome to AI in Healthcare. We're diving into something huge today, a blueprint for the future of our profession, looking all the way out to 2035. To do that, we're going to pull together insights from a couple of really important reports, one from the World Economic Forum and LEK Consulting, and another from MedTech Europe. We'll explore the massive forces and, honestly, the incredible opportunities that are shaping what medicine's going to look like. So, let's get right into it.
First up, I want to start with a question for you. Just think about your last shift. How much of your day, what percentage, was actually spent on things other than direct patient care? You know, charting, paperwork, all that admin stuff. Just get a number in your head and hang on to it as we go through this.
Look, it's no secret that we are all practicing in a total pressure cooker right now. That LEK Consulting and World Economic Forum report really paints a clear picture. We're getting hit from all sides, right? Worker shortages and burnout are through the roof, healthcare spending is just soaring, and we're seeing these health disparities get wider and wider. It's a system that's just not sustainable the way it is.
But what if there was a tool, a real tool, that could help ease some of that pressure? Well, that's exactly where AI comes into the picture. And this isn't just some far-off idea anymore. We've got some hard numbers now on the kind of impact it can have.
Now, full disclosure, the really hard data we're about to look at comes from a massive study by MedTech Europe and Deloitte. So yes, the numbers are European, but the scale of what they found gives us an incredible preview of what's possible right here in the US, and really how AI can change the game for clinicians everywhere.
So, let's get to the bottom line. What did they find? The report estimates that AI applications could save up to 400,000 lives every single year just in Europe. I mean, think about that. That's almost 500,000 people. And we're talking about lives saved because of better, and especially earlier, detection of everything from cancer to major cardiac events. The financial numbers are just as staggering. We're talking over 200 billion euros in potential savings each year. And for us here in the States, that's well over $200 billion. But here's the really interesting part. This isn't just about cheaper procedures. A huge piece of this saving comes from what they call opportunity cost. And that's a direct reference to freeing up our time as clinicians. And this number just drives that point home. The study projects that AI could free up nearly 1.8 times billion work hours for healthcare professionals every year. That is a mind-boggling amount of time. Billions of hours that could be redirected to focusing on our most complex cases, to actually talking with our patients, and to doing the high-value work we were trained for. Okay, so those are the big, eye-popping numbers. But how does AI actually make this happen on the ground? You know, in our actual clinics and hospitals. Let's take a look at how these tools work across the entire patient journey.
So AI isn't some single magic bullet, right? It's more like a whole suite of tools. You've got wearables that can spot things like AFib before a patient even has symptoms. You have AI-powered imaging that helps support our diagnostic reads. Then there are virtual assistants that can automate transcription, robotic systems helping out in the OR, and of course, the sophisticated analysis of real-world data to speed up drug development. It's everywhere.
Let's just zero in on diagnostics for a second, because this chart from the MedTech report is, well, it's stunning. Between 2000 and 2020, the number of radiologists in Europe went up by 62%. Okay, not bad. But in that exact same period, the number of medical images they had to read went up by almost 800%. That gap is the very definition of an unsustainable workload, and it's exactly where AI support tools go from being a nice-to-have to an absolute necessity. So, let's bring this all the way back to your day-to-day. Remember that number I asked you to think about at the start? The research shows that tools like AI-powered virtual assistants can potentially handle up to 30% of our administrative burden. Just imagine getting 30% of that time back. What would you do with it? How would that change the way you care for your patients?
This idea, this potential to reclaim our time and focus, it's a critical piece of a much larger vision. So let's zoom back out and look at that strategic blueprint for the year 2035 that was laid out by LEK Consulting and the World Economic Forum. Their vision for a better healthcare future really rests on four main pillars. First, transforming our healthcare systems to be more resilient. Second, really leaning into technology and innovation. Third, making sure it's all environmentally sustainable. And fourth, guaranteeing equitable access and outcomes. But the key thing here is the foundation that holds it all up: equity. Making sure everyone has the chance to achieve their best possible health. Of course, having a great vision is one thing. Actually making it happen is something else entirely. And the reports are very clear-eyed about the pretty significant hurdles that are standing in our way. This chart really highlights the barriers we have to get over. And for those of us on the front lines, I'm sure a lot of these feel painfully familiar. The skilled labor shortage, the absolute frustration of data systems that just won't talk to each other, and a regulatory system that often feels like it's years behind the technology. But here's the good news. We have the tools to start chipping away at these barriers. It's probably no surprise that digitalization and AI are right at the top of the list. But it's not just about tech. It's also going to take new kinds of public-private partnerships, new funding models that actually reward value, and a real commitment to empowering patients. It's got to be an all-of-the-above approach.
So what's next? Well, the reports lay out some pretty clear recommendations. For the private sector, it's about investing in innovation, for sure, but also investing in our welfare as employees. For the public sector, it's about making that fundamental shift from volume to value and creating smart regulations that let data and progress flow securely.
So, we've seen the pressure we're under, we've seen the incredible potential of AI to change that, and we've seen the blueprint for a more resilient, more equitable future. The plan isn't some fantasy. The tools are here, the strategies exist. The only question left is for each of us. How are we, as leaders in this field, going to help build it?
Alright, did you enjoy that? Welcome back. Let me tell you what stood out to me from that overview. First, AI-assisted diagnostics dominated November. But here's the key. These tools work best when they augment, not replace, clinical judgment. The 27% improvement in cardiovascular risk assessment only happened because physicians used AI as a second opinion, not gospel. Second, administrative automation is where you will see ROI fastest. We're talking scheduling, documentation, prior auth, the stuff that's burning out your staff. This isn't futuristic. It's implementable now. Third, the liability question is real. The AMA's position is clear. When AI influences clinical decisions, there must be qualified human intervention points. Document when you override AI recommendations. That paper trail matters. Again, quick note on how I made this video overview. So Notebook LM by Google is actually free right now. I uploaded November's key research papers and updates on AI in healthcare. And if you can see here, there's a video overview and audio overview. Audio overview will create a podcast, but I clicked video overview. So I just pressed one simple button. It generated this video overview in about 5 minutes. It's not perfect yet, but it's a massive time saver for staying current. So if this saved you hours of research and helped you stay ahead of the AI curve, go and subscribe to my channel. I do this deep dive every month. I'm Dr. TJ An, and I'll see you in the next video.